Hey guys, I'm going to do my nutrition case presentation on the paleo diet. The paleo diet is aimed at emulating our hunter-gatherer ancestors, and it's based on the idea that they didn't suffer from modern-day diseases like diabetes, heart disease, and obesity because of what was available to them and what wasn't available to them to eat. So while there's different versions of the paleo diet available, and this is all dependent on what book you read or what nutrition guru you follow, your own basic nutrition ideas, the basic premise is to eat unprocessed animals and plants, which includes meat, fish, eggs, vegetables, fruits, nuts, and seeds, and to completely eliminate sugar, dairy, and grains. When I looked online and to find studies done on the paleo diet, I came up with 5 that I thought were good enough to include as true research-based information that contribute towards the body of knowledge about how the paleo diet affects us. In study number 1, it was done with 29 men who had heart disease or elevated blood sugars or type 2 diabetes, and they were randomized into either a paleo diet or into a Mediterranean-like diet group. The outcome measures used were glucose tolerance, insulin levels, weight, and waist circumference. The study was done over 12 weeks. Research showed that only the paleo diet group saw a significant improvement in glucose tolerance. Although both groups lost a significant amount of weight, the paleo group lost more, and both groups had a reduction in waist circumference, but again, the paleo diet showed more. And overall, the blood glucose levels went down by 36% in the paleo group compared to just 7% in the Mediterranean diet group. Every patient in the paleo group, remember this is just 30 patients, but every patient in the paleo group ended up having normal blood sugars, while only 7, so about half, just under half, of the patients in the Mediterranean-like diet had a normalized blood sugar level. So the conclusion of this study was that a paleo diet led to greater improvements in waist circumference, glycemic control, improved with weight loss, and allowed for a decrease in waist circumference as compared to a Mediterranean-like diet. Study number 2, 14 healthy medical students, 5 male, 9 female. They ate a paleo diet for 3 weeks. There was no control group, but overall weight decreased by an average of 5 pounds, BMI by an average of 0.8 if you subscribe to using BMI as an outcome, and the waist circumference decreased by an average of 0.6 inches. So overall, weight loss and a reduction in waist circumference. Study number 3. 13 individuals with type 2 diabetes participated in a crossover study whereby they ate a paleo diet for 3 months and then they did a typical diabetes diet for 3 months. Now, I'm not sure what a typical diabetes diet is. It wasn't explained in this study, but we'll just assume it differs from a paleo diet in a certain manner. On the paleo diet, the participants lost 6.6 pounds more than the participants eating in the diabetes group, and they lost another 1.6 inches off of their waistline as compared to the diabetes diet. This particular study used markers with blood work, so they looked at the HDL of patients. There was an increase of 3 milligrams per liter, or 0.08 millimoles per liter in the paleo diet compared to the diabetes diet. There was a decrease in triglycerides on the paleo diet, and there was a decrease in the marker, which is called HbA1c, and is a marker for 3-month blood sugar levels on the paleo diet. So overall, this study found, and this was the longest study in all of them that I looked at, but this study found that the paleo diet caused more weight loss and several improvements in cardiovascular risk factors as compared to a diabetes diet. The last 2 studies go on to show yet again that the paleo diet is favorable for weight loss and reduction in waist circumference. So overall, all of the studies all show that the paleo diet is favorable towards short-term weight loss and causes a reduction in waist circumference. Limitations to all of these studies are their small sample sizes, as well as many of them not having a control group. Furthermore, more research needs to be done to see the sustainability of integrating these eating practices over the long term. Follow-up with participants should also be done on a regular basis to determine the sustainability of adopting the paleo diet in your lifestyle. Fun fact, red wine is paleo. Cheers, guys. Bye.